Unveiling the mysteries of implantation bleeding.
Hello there. Today we're diving deep into a very important topic for those trying to conceive: implantation bleeding. This is often one of the earliest signs of pregnancy, and can sometimes be mistaken for menstrual bleeding. Let's explore the symptoms and characteristics of implantation bleeding, especially when it occurs just a day before your expected period.
What is implantation bleeding?
Implantation bleeding is a light bleeding or spotting that happens when a fertilized egg attaches itself to the lining of your uterus. This usually happens about 6 to 12 days after conception. But here's where things can get a little tricky. Implantation bleeding can sometimes occur around the same time as your expected period, which can lead to confusion.
What are the symptoms of implantation bleeding?
If you're experiencing implantation bleeding one day before your period, you might not even notice it. But if you do, here are some of the signs to look out for. 1. Light spotting. This is probably the most noticeable sign. The spotting is typically lighter in color than normal menstrual blood and doesn't last as long. It can range from light pink to dark brown. 2. Cramping. Some people experience mild cramping during implantation. However, these cramps will be milder than the ones during a regular period. 3. Change in cervical mucus. You might notice a change in cervical mucus. It could have a slight pink or brown tint to it due to the small amount of blood that was discharged. Remember, these symptoms can vary from person to person, and some might not experience any symptoms at all.
How is implantation bleeding different from a regular period?
While implantation bleeding and a regular period can sometimes look similar, there are key differences to consider. 1. Duration. Implantation bleeding usually lasts for a few hours to a couple of days, whereas a period generally lasts between 3 and 7 days. 2. Color. As mentioned before, the color of implantation bleeding can range from light pink to dark brown, while menstrual blood is usually bright to dark red. 3. Flow. Implantation bleeding tends to be very light spotting, not a flow like a regular period. 4. Cramping. The cramping associated with implantation tends to be milder than period cramps. Understanding these differences can help you distinguish between implantation bleeding and a regular period. And that wraps up our discussion on implantation bleeding. While it can be tricky to differentiate implantation bleeding from a period, especially when it happens just a day before your expected period, understanding the signs and symptoms can help. Remember to consult a healthcare professional if you're unsure or if you have any concerns. We hope this information has been helpful and illuminating.